we all know we should eat healthy and exercise and try to get a good night's sleep. But those aren't the only things you should be doing to stay healthy.
Yeah, coming up after the break, the 5 medical tests that all women need to get.
It is National Women's Health Awareness Month, and that is why we are here with Dr. Angela DeRosa, and she is actually going to fill us in on 5 preventative screenings that all women should at the very least consider, but really eventually go through at one time or another in their life.
As much as we don't like to do the preventative screening, and we always are the last to take care of ourselves, it's important. And we often think of getting our mammograms and doing the breast checks, but there's other things as well that we should be considering, such as getting a good look at our skin, making sure we're not having skin cancers develop, that we are also getting those dreaded colonoscopies after the age of 50 that nobody wants to think about, but colon cancer is very common. And also really thinking about heart health, which is the #1 killer of women.
And speaking of heart health, one of the things that we're looking at here is a patient here in your office who's having an EKG.
Yes, and it's a simple study that we can do. It just takes a few minutes to get the EKG machine hooked up to the patient, which is detecting actually electrical activity of the heart. So it's going to help us determine, are there any heart arrhythmias? Is there any lack of blood flow going to the heart, so that we can screen for those cardiovascular risks in women. And actually, as I said earlier, it is the #1 killer in women. We often get upset about breast cancer, but you're likely to die from a heart attack versus breast cancer as a woman.
Is this something that we would ask our general practitioner to perform, or do we need to call a heart specialist?
No, a basic primary care physician should be able to do this test very easily in your office and do this yearly starting at the age of 50. It's a very nice screen. So when patients come into our office for their annual physical, obviously we want to do the mole checks. We get the EKG on the patient, we get them set up for their mammogram, pap smears for the patients who need it, and their colonoscopy. You got those big 5, you're ready to go.
All right, and are there any when you talk about the ones that we should be checking into, are there any that we just need to avoid?
Well, a lot of people talk about salivary testing, and frankly, it's a waste of money and time. I don't think you really need to get involved with that. There's also CAT scans looking for calciums in the body. There's a lot of cardiologists who think that that might be important, but not necessarily needed at most stages.
All right, you're making us feel better, what we do and don't need. Thank you so much. Appreciate your time this morning.